At 26 weeks pregnant, you are about 6.5 months along, and you have roughly 14 weeks left to go. Your baby now weighs around 2 pounds, can you believe that? In just the past week, your baby has gained about half a pound. Your baby is also about 10 inches from the crown to the bum and around 14 inches tall. It's amazing how quickly your baby is growing. At this stage, your baby's eyelids are no longer sealed shut, so their eyes can now open. Their vision is still underdeveloped, but it will continue to improve over the coming weeks. If you're thinking about getting a 3D ultrasound, now is a really great time to do it. Your baby is starting to fill out with fat and look more and more like a newborn. You can see facial features like the shape of the nose and mouth, and honestly, they're pretty adorable right now. Once you get closer to around 30 weeks, there's less room in the uterus, and it becomes harder to get clear images. So, in my opinion, 25 to 30 weeks is the best window to get a 3D ultrasound if that's something you're interested in. Some OBs offer them right in their office, so you can always check with your OB to see if that's an option for you. Here's some footage from my last baby's 3D ultrasound. She was pretty squished in there, so my pictures weren't quite as good as what you might get, but this time frame really is your best chance to get some super cute images. You may also start to notice more Braxton Hicks contractions. I talked a lot about this in week 25, but if you're having Braxton Hicks, it's important to pay attention to how many you're experiencing. 3 or 4 in a day is totally fine. If you start having more than 4 in an hour, grab a big glass of water, consider taking a warm bath, and then lie down. If you're still having 4 or more contractions in an hour after that, you should call your OB or go to labor and delivery to get checked out. The reason I emphasize drinking water is because dehydration can trigger frequent contractions, so make sure you're staying well hydrated. You're also going to be feeling more and more baby movement, and those movements are going to start feeling bigger, stronger kicks and punches that will keep getting more noticeable. Just remember, your baby isn't going to be kicking non-stop all day and all night, and that's completely normal. If you notice a stretch of time when you don't feel movement, your baby is likely just sleeping. The key is to pay attention to your baby's movement patterns. In just a few weeks, you'll be doing something called kick counting, and we're going to talk all about that in week 28. So make sure to hit the notification bell so you don't miss that video. Sometimes, you can gently push on your belly, and that may prompt the baby to kick back. You'll also probably notice that when you lie down to go to sleep, your baby suddenly gets more active and starts kicking. That's likely because during the day, when you're up and moving around, you're kind of rocking the baby to sleep. Once you finally sit or lie down, they tend to wake up and move around. And as tired as you probably are at night, it can be a really sweet time to feel your baby move without all the distractions of a busy day. Just as a reminder, it's not recommended that you sleep flat on your back. We suggest sleeping on your side, preferably your left side. You can also consider getting a pregnancy pillow. There are C-shaped and U-shaped pregnancy pillows, and they're designed to support your back, your belly, and the space between your knees. As you get further along, having a pillow or something in between your knees can really help support your hips and make sleeping more comfortable. Here are a few more tips to help you get a good night's sleep. You might be dealing with heartburn, which is extremely common during pregnancy. There are a couple of reasons for this. First, your body releases a hormone called relaxin. Relaxin is important because it helps your ligaments loosen up to prepare for birth, but it also relaxes other muscles like the ones that keep stomach acid in your stomach instead of allowing it to move up into your esophagus. On top of that, your growing uterus takes up more space, leaving less room for your stomach, which can make heartburn even worse for some women. You can take Tums or over-the-counter omeprazole for relief, but make sure to talk to your OB first just to confirm that they're okay with you taking those. Your growing uterus is also putting a lot of pressure on your bladder, which means there's less room for it to fill. This leads to more frequent trips to the bathroom and more urgency. Sometimes you don't get much warning at all before you have to go. Your hormones may also be having a big impact on your emotions right now. You might find yourself crying for no apparent reason, and that is completely okay. There are 3 major times in our lives when hormones are really intense: during puberty, during menopause, and during pregnancy. So give yourself some grace and let yourself feel what you're feeling. Your hormones are intense, your belly is growing, your ankles may be swollen, you have to pee every 5 minutes, your back and hips ache, you're dealing with heartburn, and your belly button, which used to be an innie, is now an outie. Honestly, any one of these things is a very reasonable excuse to feel a little ornery from time to time. You may also start feeling like you need to slow down, and if that's the case, listen to your body. If you need to rest, then rest. And if you're feeling good and have the energy to get things done, go ahead and get things done. You might be noticing a stronger urge to get things done around the house to prepare for the baby organizing, cleaning, nesting, and maybe even some baby proofing. This is a very natural mama instinct, so go with it. A lot of this stuff probably needs to be done anyway, and chances are you won't feel quite as motivated to do it as you get further along in your pregnancy. Now is also a good time to start thinking about getting the nursery ready. Whether you have a whole cute nursery planned out or your baby will be sharing a room with other kids, the American Academy of Pediatrics recommends that your baby sleep in your room for at least the first 6 months of life and preferably the first year. This has been shown to decrease the risk of SIDS, which stands for Sudden Infant Death Syndrome. They do not recommend sleeping with the baby in your bed, so co-sleeping isn't advised. Because of that, it's important to think about where your baby will sleep. Many parents choose a bassinet, and there are even bassinets designed to sit right next to your bed, with one side that opens. This allows your baby to sleep in their own space while still being close enough for you to see them, talk to them, and rub their tummy while you're in your bed and they're in theirs. It also allows for good airflow around the mattress. The American Academy of Pediatrics also recommends putting babies to sleep on their backs. Once babies are able to roll over on their own, you don't need to keep flipping them back, but always start them on their backs when you put them down to sleep. At this point, your baby's sense of smell has developed, and they're able to smell the flavors of the amniotic fluid. They're also starting to develop a sense of equilibrium. Thank you so much for watching.